have several items here to go over. On page 7, there's a then and now certification approval request. And that is for PFCS and Carroll County Common Pleas Court. Would you mind telling us about that, Michelle?
Sure.
I have several items here to go over. On page 7, there's a then and now certification approval request.
Hold on.
And that,
Are we echoing?
Yeah,
Yes.
I've got to mute the
Carroll County
YouTube thing.
Common
Hold on
Pleas
here.
Court.
There we go.
Okay. Basically, these two are payments for grants that were just awarded in February, but were effective back in September of 2020. So the agencies have expenditures that go back in time. And because we just received the approval and we're able to, budget for it and get it appropriated and all that kind of stuff, it's definitely a then and now, because the services are too old for us to say that they're current. Does that make sense?
Mm-hmm. Okay. All right. But so are you saying the services have already been provided?
The agency continued to provide the services, both personal family counseling services with the awareness campaign, and then Carroll County Common Pleas with their SOAR grant that they use as a navigator. And their services, they continued them. Well, PFCS started them in October. Carroll County Common Pleas continued them since October. So I have all these expenditures from last calendar year, and the money we weren't even approved to have the money until February of this year.
So Julie, these are both grants, the RSP grant and the SOAR grant. The RSP grant from Guidestone is doing outreach to the Hispanic community, some awareness efforts, and Carroll County SOAR is their court-based navigator. That just continued on through the last couple years, but as Michelle said, we just got the funding that went back to the beginning of the grant cycle, and their invoices are just rolling in.
Okay, that makes sense. And I guess lucky for us, they were willing to continue doing that with the promise that the money would come.
Great.
Yeah. Okay, well, we'll need to does anyone have questions about those 2 items on the then and now certification that Michelle didn't answer? If not, we'll need to have a motion and a second and take a vote on that.
I move that we approve the then and now as stated.
Thank you. Is there a second?
I'll second. This is Mark.
Okay, thanks, Mark. Okay, all those in favor, please say aye.
Aye.
Aye. Any abstentions? Anyone opposed? Motion carried. All right, next is the budgetary adjustments that are listed on page 8 and 9. And it looked like those are mostly around salary line items.
Most of them. There's a couple of different things in there. The very first one, I know last month we talked about Community Mental Health Care's audit going over their budget. We did go ahead and approve it, and we did pay the agency that amount, but I wanted to make it official and do a line item transfer just to make sure that we didn't have that negative continuing on our financial statements. So I moved $1,065 from acute services to the system audit line item to take care of that. And I think we could probably do these all together if everybody's okay with that.
Okay.
So the next one, that's the fiscal year, that's the state fiscal year 2021 board operating budget that's being affected. And that basically, when we were doing negotiations for salary increases, Natalie's increase was larger than we had budgeted for. So I went ahead and made adjustments from within the actual board operating budget to increase line items and decrease other line items to cover that cost. So nothing increased. We're not taking any additional money out of reserves or anything like that. It's just, we did it within our budgetary amount.
Okay, just realigning what pots of money are being used for salary.
Right, because otherwise the county will call me on the end of, December 31st saying, you don't have enough in your salary line item, and they'll be like, what? So
Yeah.
I just want to take care of that now. The very next one is basically the same thing, but it is what I will send to the county, asking them to change the line items on their end. Because of appropriations being the way they are, I've appropriated a certain amount for salaries. So now I'm, changing the
Mhm.
amounts. So those will go to them. The last item, oh no, not the last item, the next to last item is the creation of a new account for the COVID-19 crisis funding. So that's money that we're getting from Stark County through kind of a collaboration. And that is for CSU services that are provided, COVID related, and require some follow-up in a survey tool, things like that. So I'm asking that this line be created. We don't have any other lines that I want to rename. So this would be a new line item in that fund.
Okay.
On the next page,
Michelle,
yeah,
do we need to, or did we already add that crisis funding money into our state fiscal year budget?
the crisis funding money went in at 14,000. Or yeah, we had 14,000 that we had gotten from them in advance. So we're getting, I think, up to 25,000. Is that what it is, Natalie?
Julie, this is part of a regional collaborative with our Heartland Board region. And us accepting this around $40,000 means that we will open up our CSU to individuals in our Heartland region should they need it. We haven't had a lot of individuals from outside of the county come down to use our CSU, but we're advertising it as a regional CSU. They have to have a COVID related anxiety or depression, or what the pandemic had to exacerbate their symptoms. So yes, we did begin fiscal year 21 expecting to get this money, and it is in the budget.
Okay.
Natalie, can you just tell me the acronym CSU? Sorry.
Oh, sorry, Kelly, Crisis Stabilization Unit.
Okay. And I just would like to have the last budget amendments and where we're creating a new fund and the appropriations be separate than the line item transfers,
Okay,
just to make it cleaner, I think.
all right. Then do we want to do the motion for the line item transfers now and then continue with the?
Yeah, so we're talking about, there would be a motion for everything above the new line item request that would go on one motion, and then we'll do a second one, right?
Yeah.
Okay, all right. Does anyone have more questions for Michelle, or if not, go ahead and make a motion.
I'll make a motion that we accept the line item transfers as presented.
Okay, thank you.
Seconded.
All right, all those in favor, please show your hand or say aye.
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 Okay, any opposed? Any abstentions? Motion carried. Okay, now moving on to the new line item request, and then the budget amendments for the money that will be flowing into that line item.
Okay, so as I said, that line item there, the COVID-19 crisis funding, is just a new request. And if you scroll down to the next page, I'm basically, can you scroll down a little there, Mike?
For some reason, I don't seem to be able to. I don't know. what's
Okay,
going on.
well, if you look in your
There we
packet,
go. I got it.
okay, all right. All right, this is just basically asking for appropriations and receipts. So we're asking for funding to be added to the crisis funding line item, and also in the expense line item as well, just so that we can do business. The one that's right below that is for $50,000 for an increase in the CARES indigent hospital funding. we were able to apply for an additional 37,000 in the indigent hospital fund. And we have a couple of high users in there. We were awarded the 37,000. And we're hoping that maybe if we do have some high users, that we can get some additional money if somebody's underspending in their, in their county. So that's, and just because it says 50 in there does not mean we have to spend the 50,000. If we spend less, I will just do an adjustment prior to the end of the year to bring all the revenues and expenses back in line with what they should be. So I don't want you to think we're just pie in the sky, but Veronica has the 37,000 for sure. And then the balance is basically, she has about 3 or 4 high users that she's concerned about. So she wanted to get a little bit of a cushion in there, and hopefully the money will come. If not, we won't pay it.
Okay. Remind us, is the indigent hospital expenses, is that just for expenses at Heartland, or that could be at other private hospitals if Heartland can't take the patients?
So Julie, whenever COVID hit and Heartland had to close units and decrease capacity, people couldn't get into the state hospital. And so what the state said was, we're going to give you money to contract with a hospital when you can't get individuals into Heartland.
Okay,
So our contract is with Generations. They've worked very well with us, and that's the only hospital that we have a contract with right now.
okay. I thought that was the case, but wanted to make sure. Thanks, Natalie.
And
All right.
Natalie, is it only inpatient?
Correct. And it's psych inpatient.
Okay.
It does include ambulance coverage though.
Sorry, I was just thinking mental health and addiction. Yes.
All right, if there are no other questions, then we would need a motion and a second to approve the new line item and the amended certificate and appropriations.
I make a motion to accept the new line item request and the amended certificate and appropriations.
Thank you, Jen.
Mhm.
Is there a second?
I'll second.
Kelly? All those in favor, please say aye.
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 Aye. Any opposed? Any abstentions? Motion carried. All right. Next item that we need to look at is the approval of expenditures for April, and that's pages 10 and 11 in the packet that Danielle sent out. Is there anything that you would like to point out to us in this list of bills, Michelle?
About 2/3 of the way down, number 712, community education, you will see Healthy Tusk. That's a $5,000 payment. That is to assist in the process of them doing a community needs assessment to help fund that. And that happens, the needs assessment happens every 3 years. So you will not see that on the budget or on the list of bills every year. It'll be, periodically. Let's see, the other one. I did, you'll know when we see that, when we look at the revenue and expense report, you will see that I backed some things out of acute services and created their own line item. And that would be for 741 CAR, which is the CARES Indigent Hospital line item. Instead of putting it in there and listing it as CARES, we didn't really budget for CARES to be in that line item. So I went ahead and created its own line item, and the things that were already in it at the acute services, I made adjustments to the ledger and made sure that they all went into this particular line item. So right now, the acute services are just showing things that would actually be paid through acute services, not non-federal things that are being paid through acute services.
What do we contract with Christy Wilkin for? I know that she's involved and is one of the founders of our suicide prevention group, but I thought that was a kind of a separate pass-through fund.
It is a separate pass-through fund. We pay for her to facilitate the group.
Oh,
So, I mean, we're reimbursing her for her time, and she's putting in more than she bills for. But but then her coalition is making that money. So that's why we hold it separately for them.
Okay, thank you.
You're welcome.
Any other questions with the list of bills for this month? If not, we'll need a motion and a second to approve them as stated on page 10 and 11.
So moved.
Thanks, Mark.
I'll second.
Thanks, Kelly. All those in favor, please say aye.
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 Any opposed? Any abstentions? Motion carried. Okay, then we are moving on to the financial statements on pages 12 through 15. And we're, probably a little over 3/4 of the way through our budget year for the state.
We've actually just received in April most of our fourth quarter allocations from the state. So next month you will see most of the state allocations anything that's not a drawdown will be at 100%. So, and that's a good chunk of money. I think it's probably about 400,000 total just for that amount. So in addition to anything else that we receive. So I think the revenue is in pretty good shape. But if we move on to the expense page, I just wanted to bring your attention to the acute services, and because you'll wonder why I have this giant negative. Okay, 21, you'll see in parentheses under current month, $21,262 under acute services. Those were the generation behavioral health expenses that were paid and put in the account, the acute services account. And I just moved them down to have their own account. So the federal would be separated from that. And if you look down further at the very last thing you can see on the screen, CARES Indigent Hospital Fed,
Mhm.
that's the total amount that we would have paid generations, including today's payment.
Okay, so the reason for the deficit in the acute services is because we were moving the line items around?
Yes, I did an adjustment
Okay.
to remove those expenditures from that line item. So that negated what the total year to date was. And then I put them in their own line item.
Okay. All right, and then if you scroll on down just a little bit further, Mike, had we spent about 20 or 68% of the budgeted
Yes.
ounce? Okay, I thought that's what I recalled. So that maybe is a little low, Michelle?
We had a pretty good catch up this month, especially with personal and family counseling services. So I don't know if everybody is kind of a little bit behind, but you really never know until it's the end of the year and everything gets put in. I don't know if there's that much outstanding. ComQuest has not been billing large amounts at all. Their billings are really small. So, their mental health Medicaid, we did give them, or non-Medicaid, we did give them an increase in February, but they've never sent back the contract to even try and recoup what they've already billed for mental health.
Do you think that Michelle or Natalie, that could be indicating that they're doing better with getting their people enrolled in Medicaid?
My suspicion, Julie, is that their CEO just there's a new CEO coming to ComQuest, and I think that it's probably going to be a different experience working with them and their billings over the next couple years.
Okay. All right. Because we do know that the Carroll County Court is referring to them and they're serving the Carroll County clients predominantly, correct?
Correct.
Okay, so so them not submitting billings does not really is not a good indicator that Carroll County residents aren't getting served.
Correct.
Okay, all right.
Do we know that number? Like, can we have that, or can we see that from the drug court of what they are serving or referring to them?
Yeah, we can see if we can get that number. Are you wondering drug court specifically, or are you wondering kind of generally what their caseload's looking like?
Yeah, just like, what does it look like in regards to referral? It would be nice to have a breakdown a little bit of what's for addiction versus what's for mental health.
I will see if I can get that.
Thank you.
Sure.
Okay. Does anyone else have other questions about the financial statements for Michelle or Natalie? If not, we need a motion to approve those statements as presented on pages 12 through 15.
I make a motion to approve the financial statements as presented.
Thank you, Jennifer.
Go ahead, Kelly.
No, I'm waiting for you.
I'll second that.
Thank you, Mark. All those in favor, please say aye.
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 Any opposed? Any abstentions? Motion carried. And then our last item is the calendar year 2020 audit. What's that about, Michelle?
Super excited. It's, the auditors are going to probably be working from home. The auditor that did our audit last time will be the same person doing it, but she should have help from a full-time employee. So she's thinking she'll be a little bit quicker this time. Here's hoping. They're going to, because they're going to be off site, I'm going to be packing up a bunch of my information that they need to take with them. And she was very good about bringing everything back the last time. There was nothing missing. So that's going to probably start taking place maybe next week, early next
Okay.
week.
I personally cannot believe that it is already time for that to happen again. It
Well-
seems like it was just like so recently that it concluded.
The report wasn't released until September.
Yeah.
Okay.
So it does seem fast. It's, yes.
Okay. But it typically does start at this time of year.
They actually wanted to start it last month, but they weren't ready. They had other things going on that they had to take care of. Somebody else's audit got bigger and better than they thought.
Well, let's all pray that doesn't happen to ours.
Amen.
So, okay. Is there anything else, any other business that for the budget committee today?